It's gonna think, oh, here we go. We're live.
We're live.
We are live
Hi.
here from Las Vegas. This is a Create Your Mind experience, and I'm here with Seth-Deborah Roth, who is a medical hypnotist.
Yes.
And we're here today to discuss all the myriad of ways in which you can use hypnosis to communicate with the body. So to start with, Seth-Deborah, I'd be very keen on knowing a little bit more about how it's even possible that you can use hypnosis to facilitate healing.
It's very possible, and it's like everyone understands. You get nervous, right? You're going to speak in front of a class, right?
Okay, so I'm speaking in.
You're speaking in front of a class. Your stomach is doing flips. You feel like puking. Your hands are sweaty, right? That's the mind-body connection. People get that. What they don't understand is the same thing is going on in your body 24 hours a day, 7 days a week, with your thoughts making the different biochemicals, what we call neurotransmitters, and it's just being transferred to every cell in your body.
Are there neurotransmitters that perhaps everyone might know?
Probably not. I mean, there are all many different kinds.
Like serotonin, for example, is a neurotransmitter,
yeah.
Right?
Basically, what's happening is that your thoughts are being interpreted, by basically your hypothalamus. Your brain's interpreting your external world. Based upon that hypothalamus puts out neurotransmitters, different biochemicals, to the pituitary gland. We're talking about stress now specifically.
So the hypothalamus, by the way, is like the pump, the factory where most of your emotions, if not all of them,
exactly.
are made.
Right. It has to do with your emotions, your interpreting of the world.
So if you didn't know this before, your emotions are actually chemicals that are produced by your hypothalamus.
Right. And so this is something called the HPA axis, hypothalamus, pituitary, adrenal. Okay. So you interpret your world. It sends a signal to your pituitary gland. Your pituitary gland is the main endocrine organ.
Okay. And that does what?
Well, it influences your testes, your ovaries, your thyroid, your bones.
So then we get into hormones.
Right, exactly.
Okay.
So, for instance, a woman who is stressed out, her FSH and LH, follicle stimulating hormone, and luteinizing hormone, will get influenced by her pituitary gland. So you're having a little stress, send signals to the pituitary gland. The pituitary gland says, hey, ovaries, you're going to get all screwed up. You're going to miss your period because of the stress that's happening. Okay. So then the pituitary gland will send out its signals as ACTH. I mean, I just don't like getting into all those fancy words because they're not necessary. So it sends the signals to the adrenal glands. The adrenal put out cortisol. Everyone knows about that one.
The stress hormone.
Right. It puts out adrenaline, epinephrine, norepinephrine, and so forth. And this HPA axis, how you responding to stress will influence the rest of your body. Your heart rate, your blood pressure, your immune system is directly activated by those stress hormones that the adrenals put out, and how it affects your blood cells. The cytokines, all different things are happening, right? And it's happening throughout your whole body.
So what you're suggesting is that your environment, or however you feel about your environment, is then going to alter what's going on inside your body. Right?
Exactly.
So how you interpret the world around you will either cause you to feel good or bad, or stressed, or scared, or anxious, or angry, or any or all of the above.
Right.
And those chemicals will then affect your ability to reproduce. It can affect your how much stress you're having, as well as your immune system, how strong or how weak your immune system is.
Right.
Is that right?
Yeah. So the one thing to understand is there is good stress And then if there's too much of it, it becomes bad stress. For everybody, think of a curve like this, okay? At some point, if you're under too much stress, and it's very subjective from person to person, then you start having decline in your health.
Okay.
Because your body is becoming too stressed.
So a little bit of stress, and you start to get healthier, or
well,
what?
You need to be able to get away from the bus that's coming at you or the car. I mean,
Right.
So stress is good. I mean, you need to be able to respond. But at some point, if you're spending every day being, worried about that bus that came to you last week, you start to be stressed and stressed and stressed, and your body starts to get accustomed to that amount of stress.
Right.
And that's where the decrease in health starts.
So there's a diminishing return.
Right, exactly.
Okay.
Yeah, yeah.
So so you interpret the world around you. It in turn affects how you feel, how your hormones work.
Right.
And it affects your immune system.
Directly affects your immune system. I mean, there's no doubt about it.
And this is all being affected by your thoughts.
Yes. Yeah. Yeah. I mean, our body is 70% water, and it gets transmitted through your blood system to every cell in your body.
Wow.
Yeah. Yeah. And so you can see if you're feeling these negative, if you're feeling a little bit of anger. Okay, but imagine what happens if you're feeling anger and you're internalizing it day after day after day, month after month. What's going to happen in your body?
And you tell me.
Well, we can definitely, if the immune system is not reacting well, if it doesn't have what it needs, you can start to get sick. It's, let's say, I have a daughter who just finished college, and definitely at final time, the kids are stressed and they start to pick up a cold a week or two before, finals, or perhaps right after finals, they get sick because they have been under so much stress all the time. And as soon as finals are over, the body goes, oh, and they get sick.
Right.
Very common. Very common.
It's I guess very commonly documented in medical literature that stress has some very severe side effects, including suppressing the immune system.
Right.
I hear it also has some negative side effects in terms of health and cardiovascular health.
Right, and if you're under stress for a long period of time, your blood vessels will actually lose their elasticity. If you're under stress for a very long period of time, you can actually have bone loss from being under stress. I mean, who would think that? You think, okay, my hands are going to sweat, but I'm going to have bone loss from being under constant stress, right? Right. Constant stress is now thought to be perceived like multiple sclerosis. Constant stress is just not good for you. If you understand that what you're doing is you're subjecting yourself to irritating chemicals or biosignatures, all the time, that is doing something to the cell.
Right. And you're a nurse, right? So
yes.
You've read the medical literature. You know about all the biochemistry and how all of this works.
Yeah, I'm a nurse and also a nurse anesthetist. I used to, I'm retired now, but I used to put people to sleep for surgery. So, and I could tell you, talking about stress there, if I had a person come to me and they're nice and relaxed beforehand, usually they go into surgery, into anesthesia, very, very nicely. And usually, unless there's something going on with the surgery itself, their blood pressure is nice and stable, their pulse is stable. If they're highly stressed and anxious before they go into surgery, then I am usually doubling the amount of medication I have to give them to put them under, so to speak.
Really?
Right, yeah.
And these are potent drugs, right? These are...
Oh, yeah. I remember back in, many years ago, I was doing this for a long time, but I remember this fellow at Kings County Hospital in Brooklyn, and he was like a big, strapping fellow, and we were giving him pentafol in those days. And the top dose is 1,000 milligrams, and usually 250 to 350, 400, maybe 500. But this guy hit like 800, and he was still. And we were fighting his blood pressure and pulse the whole time through. So that
I mean, you had to give him other medications.
It was
yeah.
You know, it's like he goes being, you know, really blood pressure up, pulse up, and it's like it kind of stayed that way. I mean, as soon as we put him really under, it came down, but not as much as other people would. Right?
When you say put him under, you mean medically, right?
Medically.
Not with hypnosis.
No, not with hypnosis, medically. You know, so
nor with a shovel.
Yeah, yeah, right. So you know, so it really does affect as far as surgery, you know, what it's going to be like. As a matter of fact, they did a study at Mount Sinai where they had breast cancer patients. They were going in for a breast biopsy, I believe. And they were doing hypnosis in what we call the induction room. That's where they start to put on the blood pressure cuff, start your IV, ask you to sign the consent forms and all that kind of stuff. And anyway, so they did hypnosis in the induction area, like 15 minutes before surgery, whatever. And the people took less had an easier induction of anesthetic, took less medication during the surgery, took less medication after the surgery. They got discharged sooner. They saved the hospital $773 per case because of the time saving and the medication saving, because all those anesthetic drugs are very expensive.
Right.
Yeah. So, I mean, you know, my feeling is that everyone should be doing some sort of hypnosis beforehand, before surgery, in envisioning themselves healing quickly, because they actually do heal faster if you're more relaxed. You know? Just think of the blood vessels; they're not tight anymore, so that your muscles are relaxed. And when your muscles are relaxed, you're getting more oxygen to your cells, to your muscles, and you're healing faster. So it's a good thing.
So with just a little bit of hypnosis, you're saying that small amount of that even just a small amount of you know, a hypnotic treatment of whatever sort or any kind of induction, if you are being hypnotized before a surgery, your level of stress decreases and your level of anxiety decreases, which then lowers your blood pressure. So you're saying stress can lower your stress can lower your blood pressure. You're saying that hypnosis lowers your blood pressure.
Right.
What else is happening in hypnosis that allows for all these things to happen?
When you're in hypnosis, basically think of that you're turning on your parasympathetic nervous system, and I'll explain that in a minute.
Sure.
You have your sympathetic nervous system, which is your fight or flight. That everyone knows about.
Well, almost everyone. So
well, your sympathetic system is your fight or flight, what you would be using to run away from the woolly mammoth.
Right.
Okay? So it will open up your pupils so that it allows more light in. Okay? It'll increase circulation a little bit, because think of it, you're running away from the woolly mammoth. Okay?
Right. So this is an instinctual process.
Right.
Right. So it's in the reptilian brain, as it will, close to your brainstem.
It has to do with your brain, not just that's called the amygdala.
The amygdala.
Not just that, but it's your whole central nervous system with what's called your autonomic nervous system. So your autonomic nervous system has your sympathetic and your parasympathetic. So think of it like a seesaw, okay? The sympathetic is your fight or flight. The parasympathetic is the opposite. It is your rest and relax, or rest and digest, as some people call it. Okay.
So we have fight or flight in the sympathetic nervous system.
Very good.
And then in the parasympathetic system, we have rest and relax.
Right. And that's what us hypnotists work with. Okay. So, so the sympathetic will open the pupil to allow light in. the parasympathetic will close the pupil so that you can go to sleep. And okay, not let light in. So anything the sympathetic turns on, the parasympathetic turns off. So they're in opposition, like a seesaw, right?
Right.
Okay. So what were we discussing?
Well, we're talking about
how it works.
Right, how all this works, so that hypnosis can, what hypnosis is doing to affect a pre and post surgery healing and reduction of stress. What is all happening there?
So when we turn on that, when we do hypnosis, think of it as if we're tickling that parasympathetic nervous system. We're helping the body to relax, muscles to relax, blood pressure to relax. Your pulse might slow down, become nice and steady. Your breathing gets slow, and actually your cortisol levels go down. They did blood studies on medical students, of course, and after hypnosis, within 5 minutes, their cortisol levels went down. Okay.
5 minutes of hypnosis,
and your
cortisol levels go down. And cortisol, again, is the stress hormone, right? So, and it's being done with medical students.
And just think about another interesting fact is that when you're stressed, your glucose levels go up immediately too. Okay, from the stress on the liver, and it's just interesting stuff. So hypnosis helps us to get to that more calm that you feel, right? Okay, and that affects your body.
So stress, clearly in surgery, for example, this inhibits your ability to anesthetize somebody because their blood pressure.
It makes it more difficult, doesn't it?
Right.
Yeah.
It decreases. It decreases to a certain extent.
Sure.
It requires more.
Right. I as the anesthetist will have to use more medication. Right. Absolutely.
And that means higher risk of side effects, which can potentially be fatal.
Right. Right.
Okay.
And the other thing is usually people what we call emerge from anesthesia like they went in. So if you have somebody fighting you, before they go under, and they're all anxious, that's probably how they're going to emerge in the recovery room.
Wow.
So you're going to end up giving them medication to calm them down, and that will maybe inhibit them being able to go to the bathroom after surgery, that kind of stuff.
Right.
So if you can stay away from giving people all this medication, that's a much better thing for them.
Absolutely.
Yeah.
So tell me more about how hypnosis is actually working to facilitate the healing process.
Well, it just allows more circulation and therefore more nutrition for the cells. But it also allows for like a calmer feeling calmer about everything that's going on. So you're talking about surgery, but there are other ways to use hypnosis for medical issues. We can use hypnosis for cancer patients, of course, for pain. We can use hypnosis for when they're going through chemotherapy, and for various ways. How I like to use it for my clients is number one, in envisioning the cancer cells opening up during the chemo and the healthy cells closing down. But also when you go to these chemotherapy units, you'll have 5, 10 people in a row getting chemotherapy. Right?
All sitting side by side.
Right, telling their horror stories. This one died, this one lost their hair. Oh, this is my 4th round of chemo. And you're listening to all these horror stories, and remember, you're taking it in. Emotionally, you're taking this stuff in.
And so this is also hypnosis, right? When
So,
you line all of these cancer patients up, right? It's like putting a whole bunch of criminals in the same building together and locking them up there for a very long time. They usually come out worse off than before they went in.
You're giving them an imprint. You're instructing them. This is the culture. Join the culture, and it's kind of like Of course, right? You hear everyone telling you these horror stories and think, I'm going to be in there.
Now, is that going to affect somebody's biology as well?
Of course.
So, because we're talking now about cancer and hypnosis, right? Which,
Right.
To a certain extent, is a little bit controversial. I mean, it's a very touchy subject for somebody to say that you know, perhaps you've had some successes with treating cancer patients, albeit perhaps as a complementary.
Well, here's all that stuff about treating.
Mhm.
I don't treat anything. I help the person to change their mind, maybe, to change their attitude, to maybe increase their own immune system, and let their body do whatever their body does.
Okay.
You know. So
what you are suggesting, though, and what is more and more prominent in literature that relates hypnosis to the medical field, is that how you as a hypnotist and a therapist communicate with the body can in fact influence biochemistry and influence what goes on in the cardiovascular system and within cells as well. Right? And
who knows? I mean, it's not like we're opening up a person and can see what's happening when they're doing hypnosis or going into self-hypnosis.
right.
But definitely there have been studies about Simonton and his wife did a study, actually wrote a book on healing during cancer. But they found out that people who had cancer and did imagery to help with how they were feeling stressed and cope with it in more better terms, felt responsible that they were involved in their care, had an optimistic point of view, that even if they didn't become cancer free, right? They lived longer anyway. You know, maybe they still had the cancer, but they still lived longer than the people who didn't. So there are studies out there, and you know, there are cases of remission and so forth. And it's not to say that, you know, the accepted ways of using hypnosis for cancer clients or cancer patients is definitely for chemo, for, you know, imagining a bubble around them while they're in that cancer unit so that they're not taking in all the negative energy and all the negative thoughts. Another accepted way is imagining a cooling cap, you know, so that they don't maybe have quite as much hair loss going on, although they now have cooling caps that they can actually rent. Definitely for pain management. I mean, hypnosis for pain management has been accepted for a long, long time. The National Institute of Health actually recommends the use of hypnosis. There are many studies out there about with pediatrics and cancer and hypnosis, using hypnosis to lessen if the child is going through like a bone marrow transplant, for nausea, post chemo. So there's all these real studied ways of using hypnosis. I don't understand personally why it's not more out there in the medical world, because there are the research studies that are accepted.
You mean to the extent that hypnosis, for example, for pain control is medically viable?
Absolutely, absolutely. And that
to the extent where you could potentially eliminate pain completely.
Well, I don't know if you can eliminate it. Some people it happens, you know. But let's say I had a client come to me who was, he had like 5 back surgeries. And that's very, very common, by the way, to have one back surgery to help take away the pain, and it helps for a little while, and then as the discs above and below the fusion start to get overused, then they need another back surgery and another back surgery. And yeah, and so sometimes you'll have people coming to you who are actually in worse pain than when they started. Now, granted, some people have back surgery and do absolutely fine, and are really grateful that they've had the surgery. But we're talking about the ones who come to you where that's not what's happening. And so I had a fellow on 16 Vicodin a day.
16 Vicodin.
That's a lot. I mean, it shocked me that.
Is this Dr. House by any chance?
I don't know who. And my thought is perhaps he was what we call doctor shopping. You go to one doctor, you get, let's say, your 8 Vicodin, right? Mm-hmm. And you go to another doctor and he gives you 8 more. But the 2 doctors don't know that you're going to both of them. Or maybe he got them on the street. I don't know. But anyway, he was on 16 Vicodin a day. And so I got him down to 5. You know, he can live his life at 5 Vicodin a day. You know, and so one of the things that hypnosis does is it helps take out the suffering. It can even help you to sleep even, right? And if you don't sleep well, you get irritable. You're not a happy camper. You usually will end up taking more medication anyway because you're irritable and so forth.
So what's the difference between pain and suffering?
Well, pain has to do with the signal and the interpretation in the brain, right? It is the brain that interprets the signal that's coming up. Okay.
And that's something that hypnosis works with.
Right. Is our perception of the pain. Okay. There was actually a study by another husband and wife team called Hilgard and Hilgard at Stanford, where they studied the use of hypnosis for pain. Right? And they found that over time, that hypnosis changes the perception of the pain. And that's one thing when you're working with a client for pain. When I have someone come to me, I say, listen, you need to know that it is 5 to 6 sessions, and you're going to have homework that you have to do. So you have to explain it to them that you're training your brain to perceive the pain differently. And there are many various techniques of that. So if you can take the suffering out of what's going on for your clients, even their pain can diminish. But you take away the feeling of, I'm only going to, this is how my life is, to get one of the chronic pain. They are really in fear that it's going to get worse. So it's really a gift to be able to change that for them. And only, if only you can have them sleep better, even that's a big deal. This is how I got into this field. I was literally 2 weeks away from back surgery. And I remembered thinking, if this is how I'm going to live my life, now I understand why my cancer patients wanted to die. I distinctly remember that. And luckily, I started to use hypnosis, and I got increased circulation in my leg and so forth. And that was back in 1987, and I never had the surgery, and I'm not in pain anymore. Most of the time, I'm not. And I feel really, really grateful, but that's how I got into this field, because the doctors really scared me. You know, he told me he was going to go through my abdomen to get to my back instead of the posterior side.
That means that you're not lying on your stomach getting surgery on your back.
Right, you're lying on your back
getting surgery on your back through the stomach.
And that means you have a whole different post-operative care. This is back in those days, where you know, I would have been in like this really stiff body cast for 6 weeks or 6 months. Someone told me, who knows? But I'm really glad I did.
You've been like Frida Kahlo had you done the surgery.
I'd be what?
Like you'd be like Frida.
I don't know who that is.
She's a wonderful artist who I think she's from Spain.
Oh yeah, and, I think I saw that movie.
She got into a car accident, and there was a pole that went through her entire body, and she was bedridden for years.
Yeah, I don't think it would have been that bad, but it certainly would have been not what I wanted.
I imagine not. No. You don't strike me as the masochistic type. So you, well, how did you do the surgery? Huh? Did you do the surgery?
No, I never had the surgery. Never had the surgery. Never had the surgery. I'm
So
really
how did you go
grateful.
from being 2 weeks pre-op?
I just started to put my hand on my hip. I started to visualize. I went into self-hypnosis, visualized healing happening. Being the medical person I am, I visualized red arterial blood going into the nerve cells, pushing out the toxins and putting them into the blue venous blood system. And I actually started to get a rise and fall visually in my hip from the increased circulation that my brain, by visualizing, was actually sending those signals to my body.
So you could literally see your leg pumping with blood.
Gently, just very, very rising and falling. Yeah, right at the hip level. Yeah, it was
Wow.
wild. As a medical person, it was like, oh my God, this stuff is real. Really, I mean, that was it, right? And I remember talking about that once. I was in, I had seen a DVD about a dental school in Pennsylvania. And they'd taken an IV, or a needle rather, and they pierced the skin, and the skin is dripping blood. And the professor was there with a stopwatch, and she was using self-hypnosis to slow down the bleeding. Now, all bleeding stops in like 3 to 5 minutes, basically, okay? So she's holding the stopwatch.
Now, I just have to pause you there.
Yeah.
Not all bleeding. Please do not practice this at home. If you're watching this right now and you're considering testing this theory out,
don't test it.
Don't test it out without medical supervision, at least.
Right. So anyway, so the professor was doing self-hypnosis, and the bleeding stopped in a minute and a half on its own. So okay, fast forward 2 weeks after that, I'm with my husband, and we're at a school function, and somebody comes out from we live in California. Someone came out from the Redwood area and said his friend had fallen off a bicycle, and so we went in to help. And friend had a bump on the head, and his nose was broken, and his teeth on the way out had ripped his tongue and his lower lip. I mean, ripped it. So first we're checking for his consciousness, checking his pupils, and da 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 da. Meanwhile, he's bleeding, so we get like a T-shirt or something to put pressure on to stop the bleeding. But because his nose was broken and he's still bleeding and he's swelling, he has no way to breathe, right? Because you can't put pressure here if you can't breathe here. So having seen this DVD like 2 weeks before, I said to him, I'm a hypnotist. I can help you. Would you like to stop the bleeding? And he said yes. That's called what's getting the hypnotic contract. It's not a medical legal thing. It's just getting him to agree hypnotically to follow your directions. So I just started talking about, the arteries closing down, the capillaries closing down. First thing we did was we thanked the blood for doing its job, for cleansing the wound, and now it's time to stop the bleeding. And I just started to talk visual, guided imagery stuff, arteries, capillaries closing, da 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 da, and his bleeding stopped. And my husband, who's also he's a surgeon, he's a urologist. So my husband and I looked at each other, and it was like, oh my gosh, this stuff really works. I mean, it was just amazing to see it in action. I'll never forget that day. It was absolutely amazing. I've never seen anything like that. Yeah.
So I would love to give an opportunity for those who are watching this right now. Obviously, practicing medical hypnosis is something that's, for the most part, best left to medical practitioners, right? Of one sort or another. Now, for those who are watching at home and who maybe have some pain, that is not some pain that is manageable. So we're not talking about a slip disc or
one of the things you don't want to use this unless if you're worried with pain. You need to know that you've seen a doctor, because you don't want to take away pain of, let's say, oh, my back hurts, and maybe they have a tumor, and that's why the back is hurting.
Right.
So you have to be real careful when you're dealing with pain that, you know, they've been to a doctor and you know what's going on. You know, but at the point of chronic pain is a different deal.
Right.
You know?
So let's say, you know, because absolutely, you know, you have some back pain, and if a hypnotist removes, well, we'll say removes the pain, although it's a little bit more complicated than that. There is a risk of doing more damage if you can't feel pain.
Right.
Right. So for somebody who maybe has some sort of let's say, I don't know, a bruise or arthritis, and there's not very much that they can do, and they generally are living their lives the way they do, and there's very little risk of doing any further damage. What is something that they might be able to do to maybe lessen that pain, or even perhaps reduce some swelling? I don't know. You can tell me.
Well, you mean on their own, or with a hypnotist who deals with medical hypnosis?
What do you think could be the? I mean, if let's say it's something that they could do at home.
Well, you know, I think what they need to do ideally is to go to a hypnotherapist who deals with this, so that they can teach them. There are many ways of dealing with this. There's a technique of dissociation. There's a technique of turning down changing what we call the submodalities. So let's say if they say, so what color is your pain? And you say red. Well, what would happen if we put some white paint on that red, you know, joint in your hand, right? Okay. What if we put some white paint on it and you could imagine it as being pink? Would that make it feel better? Or does your joint have a shape in your mind's eye if you think of it? You know, is it jagged edges, right?
Right.
So what would happen if we imagined you smoothing out that joint and making it nice and slippery kind of thing?
So submodalities are a way that we process the spectrum of how we process visual, auditory, and kinesthetic, as well as gustatory and olfactory, which is your taste and smell. So, you know, let's say brightness has submodalities, which is, you know, it can be brighter or it can be darker. Or in terms of colors, the submodalities of color would be again, you know, a higher intensity of color, more bluer, or, you know, it's
make it brighter or clearer.
Clearer. So all of these are submodalities, more jagged or more rough versus smooth, and everything that lies in between those. You know, sharp and soft, for example.
Right.
So you can also use submodalities in terms of volume, right? So you could turn down the volume on your pain.
Right, that's another very common technique. Is I tell people, imagine like an old-fashioned television dial, and you can turn it up, right?
Back when televisions had dials.
You can tell how old I am. So what I'll do in my practice, what I do is once they're in a hypnotic trance, you know, and then they can do it later on when they're not in hypnosis, and I'll explain that in a minute. I turn up the dial and make the pain just a little bit worse, okay? And you tell them, I'm going to do it, just go with me here, and then I turn it down. And I do that 3 times to make the pain worse, and then I have them turn it to where we started. Then they understand, okay, I can move this dial.
Control.
Right. Then I have them turn down the dial because they know they can make it worse. Now that lets them know that they can make it better.
Isn't it funny that we're so well trained to make things worse for ourselves in life?
So I actually use this technique. I have tinnitus, which is, you know, buzzing or ringing in the ear. Yeah. Yeah, you can stop now. And I actually, because I practice it so much, I'm able to manage it pretty well. You know, sometimes it gets a little worse. And I have a little technique now that I do if the right ear starts to do that sound, which is why you got the look that you got.
Yeah.
I will actually tap myself and I'll say, stop it. And it actually goes away. And I remember the first time I did this and it went away again. This medical hypnosis is always amazing me. I still never cease to get shocked by how well it works. And I did this and I was, oh my gosh, it worked. It went away, right? So that's one way to use it. So there are many, many ways to use medical hypnosis. Many, many ways.
And I mean, I imagine that we're still very, very new to how the mind really affects the body, and our research in how in how all of this is working is really only in the last decade or two or three really being expanded.
I think we're giving it a serious look. I know that like Memorial Sloan Kettering in their integrative medical unit, so to speak, they work with hypnosis. The Mayo Clinic, MD Anderson, Stanford is very strong on it. Actually, there was Herbert and David Spiegel, father, and then the son is taken over, and they are, I think they're psychiatrists, I think. But anyway, they're very into hypnosis. They started to bring hypnosis into the medical world, so to speak. His dad did, and he's followed. I know I'm lecturing at UCSF at the Integrative Medical Forum.
It's San Francisco?
Yeah, UC San Francisco. So it's starting to be more accepted, whether they call it hypnosis or guided imagery, but Dr. Oz uses it for those who are, it's in the United States, Columbia Hospital. He uses it for his pre-op, I think, for his heart patients. So it's starting to be more recognized. I wish more regular doctors who aren't like in a teaching hospital, right, out in private practice, I wish they utilized it more. Because medical hypnosis can help to change lifestyles, very simple things from diet to exercise. Even if you're smoking, of course, weight loss, but changing all those lifestyle habits, as well as I work a lot with people with irritable bowel syndrome, IBS, and it's been studied in thousands that they know that it will reduce the symptoms by 80% for IBS, and it stays reduced. And why every gastroenterologist or internist or family practitioner is not sending their patients who have IBS to a medical hypnotist, I don't understand. I don't get it.
Maybe there's just not enough of them yet.
Yeah, well, maybe, huh?
Seth-Deborah, thank you so much for taking the time to really share what medical hypnosis is and how it can help. I mean, we've talked about pain control, we've talked about irritable bowel syndrome, we've talked about achieving some successes with cancer, sometimes to the point of remission.
Well, at least removal of some of the treatment things that are happening to them.
Right. And we've also spoken about how stress affects the body, and even to the extent that with stress, even reduction of stress by a small fraction reduces your likelihood of catching a variety of illnesses like colds, flus, heart illnesses. I'm sure the digestive system is heavily affected by stress as well.
Helping, if someone's having an asthmatic attack, to be in control, to start to relax and turn on that parasympathetic nervous system and open up the alveoli, can really be a life-saving thing, so that you don't have to go to the hospital because you're turning blue,
And this, by the way, this is all controlled by the brain, isn't it? Your alveoles and your respiratory tract.
That has to do with the vagus nerve and so forth.
The vagus nerve. Okay, so the vagus nerve, which is the brain essentially that's in the stomach, so to speak. Yes. A new discovery. We have brains in our stomachs. So after all of this, do you have a website? Are you teaching? Are you training? Are you sharing?
I have a website, www.hypnotherapyforhealth.com.
Hypnotherapy for Health.
All spelled out.
In the link below.
Right, in the link below. I have a medical hypnosis certification for people who are already hypnotists, although online. It's on my web store. Although I do have many people who just want to know about it, who do purchase it, but I can't give you certification. There's a little test that you take afterwards, but it is, a regular person can have it. I do have a cancer treatment support hypnotherapy certification, and there's one more. The IBS, irritable bowel certification for hypnotists is online. I also have a really wonderful 11 MP3 pack for people with cancer. It has my pre-surgery, my intra-op, because I believe that everyone who has an operation should be listening to hypnosis or at least music, if nothing less. There's something called anesthesia awareness, right? And so anyway, post-operative, self-esteem, because very often people with cancer, they have their breasts removed, or different parts of their bodies removed, or their bladders are now out on their abdomen, that kind of stuff. So their self-esteem definitely needs help with, and other areas. So I'm really, really proud of that, because I used to be an oncology nurse before I became a nurse, worked in the operating room, and it's just something that really I want to help people with.
Well, that's really, really admirable. And if you're watching this and you have cancer, or you're going into surgery, or you have some sort of medical condition, or especially if you know somebody who's going through any sort of these illnesses or chronic pain, I strongly encourage you, check out hypnotherapyforhealth.com and get a certification.
I also I do Skype sessions too, and so I work with a lot of people.
And of course,
right?
Seth-Deborah is in fact a medical hypnotherapist. So if you don't want to do it alone, she is definitely here to help you. You're based out of New York, is that right?
California.
Oh, California.
But Skype allows me.
A wise move.
Right. I work with people, in London, and I work with someone in Hong Kong, so that's the wonderful thing about Skype. Sometimes I'm a little sleepy because of the hour changes, but it's okay. It's okay.
So she's here for you. And so you can find the link below. And if you are interested generally in hypnosis, you can, of course, visit the meetup group that I have as well, meetup.com/learnhypnosis. We can find a variety of different videos on learning hypnosis, and especially conversational hypnosis, conversational hypnotherapy. And this has been a Create Your Mind experience. Seth-Deborah, thank you so much for being here.
Thanks a lot. Bye, everyone. Okay.
There it is.
There it is. Just about time.